Okay, I think we'll go ahead and get started. Good afternoon. Late yesterday afternoon, we were informed of Iowa's first death related to the COVID-19 virus. I want to extend the thoughts and prayers of our state to the family during this difficult time. Out of respect for them, we will not share specific details about their loved ones, but I can confirm that the individual who passed away was an older adult, aged 61 to 80 years of age, and a resident of Dubuque County. And again, our thoughts and prayers go out to the family at this difficult time. As reported earlier this morning, today we have 21 new positive cases for a total of 145 positive cases in Iowa. There are now 2,578 total negative tests. One new county was added today for a total of 31 counties, and today the total for hospitalized is 23 as of last evening. The mitigation efforts and policies that we've put in place are intentional to protect Iowans most at risk, and those are older adults above the age of 60 and those with underlying health conditions such as heart disease, lung disease, and diabetes. 8 out of the 10 deaths reported in the United States have been in adults 65 years and older. As the virus continues to spread, it's even more important that those most vulnerable take extra precautions to reduce their risk of being exposed and, of course, getting sick. If you're a family member, a friend, or a caregiver for someone at higher risk for COVID-19, there are important steps that you can take to protect their health. Know the medications they're taking and see if you can help them have enough on hand. Monitor any medical supplies they need and create a backup plan. Stay in regular contact so you know how you can help or if their health changes. Now is a critical time when each of us can make a difference on the impact that COVID-19 will have in Iowa. We all have a role and a responsibility to mitigate the spread of the virus and protect the health of our fellow Iowans. So as I've said at every one of these press conferences, please do your part and help us all protect our vulnerable. I also want to assure Iowans that the state is doing our part to ensure that we are prepared to do whatever may be necessary to protect Iowans during this time. Every day, we are assessing our mitigation efforts to slow the spread of the virus and determining whether or not it's time to turn the dial up or turn the dial down. We are making these decisions based on metrics outlined by the Department of Public Health that they laid out yesterday. Those metrics will indicate what and when additional steps should be taken. Again, they are based on the percentage of population that is 65 or older, the percentage of identified cases requiring hospitalization, the rate of infection per 100,000 Iowans in the past 14 days, and the number of outbreaks in settings like long-term care facilities where our older populations and Iowans with underlying health conditions live. We're seeing some states issue shelter-in-place or stay-at-home orders, causing some to ask, why not Iowa? In fact, many of the steps that we have already taken are equivalent to the stay-at-home orders that we are seeing in several of these states, like closing schools and some businesses, implementing work from home and distant learning, and reducing gatherings to 10 people. The significant steps we've taken will help mitigate the spread of the virus, protect the most vulnerable Iowans, and reduce our risk of overwhelming our healthcare system. It's important also that we keep Iowa open for business in a responsible way that protects the health of our people and our economy. We are working to provide relief to Iowa businesses and employees out of work and making sure that they can access the resources they need. To those Iowans who are out of work and have been unable to apply for unemployment online, we hear you. The Iowa Workforce Development has increased the capacity of its mainframe, working with OCIO, and redeveloped field office staff to work in the call center so that they can process more claims. Approximately 250 staff are now answering calls for Iowans who need them. Finally, I'd like to end today with a positive update about PPE. While it continues to be an issue, yesterday, Homeland Security and Emergency Management and the Iowa National Guard began receiving and distributing PPE to counties across Iowa. The Iowa National Guard conducted 26 missions yesterday, 23 are happening today, and more are planned for tomorrow. And these are going to counties all across the state and based on critical need. As we've said all along, there is a national shortage of PPE, so this isn't everything that's needed, but we continue to work with our federal partners and our suppliers, and as soon as the product comes in, we're getting it out where it is needed most. I want to thank Director Flynn and General Correll and their teams for all that they do every single day to help stand up the SEOC as well as get the PPE out to those who need it. With that, I think we'll open it up for questions.
Governor, can you give some guidance to both school district officials and families who are trying to figure out, obviously it's an uncertain time, they don't know how long schools will be shut down. So you have districts making plans for potentially coming back to school on April 13th in the best case scenario. Maybe it's May, maybe it's not till the fall. But there are restrictions, as you know, that districts have to deal with when it comes to how do they provide ongoing education to the kids when they've got to make sure that kids even have technological access at home.
Right.
Is there something you can do changing current laws or guidelines to help them, or something else that can happen to make sure they can get some kind of instruction?
Yeah, so Director Ann Lebo has already stood up a task force, and we're specifically looking at online learning and how we can make sure that every child has access and the ability to do that. They're working with educators and superintendents across the state as part of this, as part of the task force to look at what we need to do to make sure that we can implement that going forward. Initially, we said that it would be, you know, we recommended schools closing for 4 weeks, said we would reassess it too. So we continue to every day evaluate where we're at as a state and what or if additional steps need to be taken. And so that will continue to happen. They have a great network in place where they're working with superintendents across the state. They are probably, if not talking daily, through email or conferences. I know it's happening every other day, at the minimum once a week, so that we continue to keep them in the loop. We're seeing fun things happen where teachers are driving by homes to give a shout out to the kids since they can't be connecting with them. But the main thing I want you to know is that they are working on that. We're looking at what we can do to take next steps and what that looks like. Also through the legislation that was passed before the legislature recessed, we addressed the number of days and hours, and the 4 weeks that we've already put into place, that won't have to be made up. And so we'll have to take a look at that, Dave, as we go forward to see if there's some additional steps that we need to take. But those conversations are happening all the time.
Can you offer any kind of time frame that they can expect any kind of state guidance?
No, I think, well, I mean, I think it's happening. They're working on that, and so hopefully they'll report out again this week. I could maybe bring Director Lebo in tomorrow or later this week to kind of give an update on where they're at with the task force for online learning and some of the things that they've implemented. You know, they've been instrumental in helping us stand up emergency daycare centers, so that's the kind of collaboration and coordination and communication that is happening almost daily. And so I can have Director Lebo come in and give Iowans an update on where we're at with education, next steps. I am not at a place where I can say we hope at this point we'll be able to do something different, because, you know, it is fluid, and we take a look at the information, the data that the Department of Health and Dr. Padati has put in place, and we reevaluate, you know, throughout the day, and then each morning and each evening when we meet to talk about what we're looking at, what we need to work on, and what we think next steps need to be.
Governor, thank you again for holding these briefings. With the metrics for the stay-at-home, I was hoping you could elaborate on what those are, what the specific triggers are in those metrics, and then also without widespread testing, how can Iowans be confident that the underlying data for those metrics are reliable?
Yeah, I think you're asking a lot of great questions. And I think it's important to keep a couple of big picture things in mind. Again, when we think about this virus, there are a few things we do know and things we continue to learn. And one of the things that we know, again, is that this is spread by droplets that move from a sick person to somebody else. And again, I know it sounds overly simplistic, but those measures of doing things like staying 6 feet away from others and truly staying home when you're sick and practicing frequent hand washing are examples of personal health measures that are really important and are going to continue to be important for this and all other illnesses. When we talk about the measures sort of to help inform how to use public health mitigation strategies, some of the things that we're looking at are the percentage of people who are over 65, so that's getting at our vulnerable population, right? We're also looking at things like the rate of cases per 100,000 in a population, and that's kind of getting at the activity level, which, you know, again, I appreciate concerns around testing, and I think, again, what's important to keep in mind is that we want people to call ahead, consult with a clinician by phone, determine if you're somebody that needs to be evaluated in conjunction with your healthcare provider, and then, you know, we've continued to work to support testing that continues to expand at our state hygienic laboratory as well as at commercial laboratories throughout the United States. And while I have the chance, I do just want to also acknowledge how deeply grateful we are to our healthcare workers and providers who truly are on the front lines of this and who have been working around the clock to take care of patients and help keep Iowans safe and healthy. And we're very grateful to them, and we're going to continue to work with them and provide them support as we go along in this. And again, I think that's support that every Iowan can offer our healthcare workforce, right? By doing the things that we ask, like staying away from other people, avoiding large gatherings, washing your hands frequently, and truly staying home when you're sick. Those are going to be really important things and steps that we can all take to help limit the spread of this and really protect our higher risk people. Which brings me back to some of the metrics that I think you were asking about. So we talked about looking at our vulnerable population, we talked about looking at cases in the community, and also about severities. So we would look at percentage of hospitalized cases, as well as long-term care or healthcare facility setting outbreaks. And what that's getting at, again, is our vulnerable populations who live in a communal setting and are associated with something high risk like healthcare. Because again, we know that part of what we're all trying to do together here, right? If we're mildly ill, we really want to stay home and recover on our own so that we can free up our healthcare workers to really be taking care of our sickest Iowans, whether it's for COVID-19 or anything else. Thank you.
And to kind of follow on that, Governor, you mentioned that it was the guidance you've already issued is kind of equivalent to encouraging folks to stay at home.
Yep.
Why not take that extra step and make kind of a formal declaration?
Because I want to continue, as I said yesterday, to make the decisions based on the data and the metrics that we put in place, and I have done that all along. So what happens a lot of times is it turns into all of the things that are allowed instead of talking about what we've already done. So if Iowans do what Iowans should do and be responsible and follow the measures that we put in place, it does exactly what Dr. Padotti just said. It helps us protect the most vulnerable Iowans, and it ensures that those healthcare providers and our first responders and those essential services individuals, you know, are able to continue and provide the services that we need them to provide. They're standing on the line. They're doing, you know, yeoman's work, and we're so grateful for what they're doing. And so they're a part of this equation too. And so we're going to continue to look at metrics, and we'll make decisions based on that. But the end result is the same. People need to stay home that can stay home. Employers that have the opportunity or the availability to allow their employees to work from home, they need to be doing that. If you need to go out, make sure it's, you know, make sure you're practicing social distancing, all the things that Dr. Padotti just laid out. If we all do that, then we will get through this, we'll bend the curve, we won't overwhelm our healthcare system, and we'll get things back to normal sooner rather than later.
I wanted to ask if you had numbers on the amount of PPE that the state is getting from the federal government and the national stockpile, and if you had an update on the number of ventilators that the state has, and if the public is going to be able to get those numbers.
Yeah. So PPE changes. Well, Joyce, do you want to give an update on some of the ones that we got from the national stockpile that's coming in, and then I can give you.
And I do not have specific numbers in front of me, but the types of things we are both ordering. As the governor has said, we're looking at all approaches to this. So strategic national stockpile is one of those. Purchasing through the state system is another. We're buying lots of gowns, lots of gloves, swabs, test kits. We have some ventilators on order. I believe it's a very small number because they're very hard to find. But we are looking at everything from is it gowns, is it gloves, is it caps, everything. We're looking at all of those, and as the governor has mentioned too, we're looking at our state agency partners to see who might be able to make some products as we're hearing about those lessons learned from across the country.
Okay. Will we be able to get the numbers that you have put in for orders?
I will need to check on if we're giving out those numbers, and I don't have a compiled list right now, but I'll check on that for you.
So, and you just have to keep in mind, I mean, that's a snapshot of what's happening because it's an all-above approach. And so we're asking hospitals to contact their vendors and put in orders. We're working with business and industry across the state, the Department of Corrections, and then through the WebEOC, they are coordinating what's coming in from the SNS and identifying where the critical needs are at and then allocating and distributing those in the manner in which they need. When it comes to vents, we have approximately 280 right now. We have another order in. We are procuring more all the time. We have healthcare providers that are working with the new CDC guidelines. We're an anesthesiologist. Is that correct? Am I on the anesthesia machine? Okay. Well, I am not a healthcare provider, and so quite obviously. Anyway, they're looking at ways that they can retrofit those and provide additional vents to some of our healthcare providers. So again, I mean, that's the type of conversations and things that are happening on a daily basis. And then I think we did get some in yesterday, and we've got another order coming in to the SNS.
Governor, do you have, this might be for Dr. Padati as well, can you explain why we're seeing the daily double-digit increases in the positive cases? Is that spread or is it increased testing? And sort of a second part of that, probably the most questions we get would be about our testing capacity. So can you update us on where that stands today and where we're headed?
Yeah, I think you're asking some great epidemiologic questions, and this is an example of a pattern that we follow closely and that we're going to continue to follow, just like everybody else in the country and globally. And you're right that sometimes, there are things you have to take into consideration when you look at patterns, right? You think about the incubation period. So somebody who's diagnosed today would have been somebody who may have been sick or incubating for a while. We take into account things like people who presented to healthcare, right, and had certain symptoms and fell into certain groups. And I think it's important to keep all of that in mind. And looking at those numbers is important because it does help us understand patterns, it helps us understand activity, but we have a variety of other ways that we look at illness activity levels. And again, part of what is so important, is that if somebody is mildly ill, they should stay home and take care of themselves and recover there for all of the reasons that we've talked about, which include preserving our healthcare workforce and resources for our sickest Iowans. But we're going to continue to work with our state hygienic laboratory that continues to expand their capacity, as do the national labs. We want to make sure that we're evaluating patients appropriately and always keeping in mind, that we address as best we can the clinical care of patients, as well as public health safety. And things will continue to evolve just like they have all along in our response to this outbreak. And so, for example, as we get tools, things like medications or vaccines, that might also impact sort of how we're able to test and what the implications of testing are.
Do you have where we are on testing ability?
Yeah, 1,270 as of today. The number of tests available, the people that we can test. Now that's through the state hygienic lab. So remember, we have the commercial test. We have hospitals that are now coming online and they're able to test too. So when we say people are sick at home, call your clinician. They'll walk you through an assessment and make a determination if you need to come in and maybe test for the flu. So it might be the flu that you have. And if they decide that that's not it, then they maybe will go to the next step and test for COVID. But that's outside of what we have for the state hygienic lab.
Are you tracking everything then? So your numbers there are just for Iowa City, but are we as a state tracking what the privates and the hospitals are doing too?
Yep, that's also included in the total positive and the total negative. When I give you that at the end of the day, I don't know, what are you asking?
when you're saying 1270 is our current capacity, but that's just with,
The state hygienic lab.
Yes.
So I don't know if I know capacity from the, we wouldn't know that. But those numbers are increasing all the time. And so I think when I talk about that in that context, people are saying, you're being narrow, you're not testing enough. We are being specific, and that has continued to broaden in what we are testing at the state hygienic lab. But in addition to that, really Iowans have the opportunity, working through their clinicians and doctors, to also get a test. So it's, and their parameters are different. I mean, I'm sure they're using some of the same guidelines, but they're a little bit different than what the state hygienic lab potentially is using.
One more question in this room before we move to the phone. Nick.
We've confirmed that, or multiple long-term care facilities have confirmed that they've been exposed to the coronavirus. Has your administration reached out to those facilities specifically, and is there any additional mitigation that's being advised to long-term care facilities?
Well, you know, it's part of the metrics that we're using when we're trying to decide what next steps are, and I'm just really proud. You know, we took a very proactive step when it came to addressing our long-term care facilities because we knew that was an extremely vulnerable population. And so one of the first steps that we took early on was to provide guidelines to nursing homes. We also met with the Long-Term Care Association. We sat around the table to make sure that we were consistent in the messaging, talking about reducing the number of visits and what that looks like, and just extra steps that they could take to be ready for COVID-19 as we saw it start to expand. And then in addition to that, I don't know if you remember or not, but the Iowa Department of Public Health made great efforts in reaching out to every single nursing home, which is about a long-term care facility, which is about 444, to make sure that they had a contact there and that they knew they had a contact at the Department of Public Health. So they really took a lot of proactive steps in the beginning to really do everything that we could to mitigate the occurrence happening and to really try to, again, bend the curve and make sure that we're protecting some of our most vulnerable Iowans. We also, the Iowa Veterans Home and the Department of Human Services with our state facilities and the Department of Corrections, they implemented many of the same procedures. We stopped non-essential travel outside of Iowa. We also said if anybody traveled outside of Iowa when they came back, they had a mandatory 14-day isolation because, again, we know those are really vulnerable populations there, and just the rate of spread could increase so rapidly, and of course the potential rate of deaths also would be high in those areas potentially. And then they have the guidelines have been adjusted with CMS along the way, so that's continued to adjust. Right now they have shut down visitations, and again they base those decisions on working with the Department of Public Health as well as working with CDC guidelines, and I'm talking state facilities right now, but our long-term care facilities have implemented many of the same procedures. One door in and out, somebody meets a visitor and it has to be pretty critical, temperature taken, assessment, wash the hands. I mean, so they've implemented a lot of precautions. It doesn't mean that we can completely stop it, but they really have been very proactive working with the Department of Public Health and the CDC to make sure that we can mitigate it to the best of our ability.
First question, David Pitt.
Yes, thank you. I have like a two-part question. The first is we have about, it looks to me like 6% of those tested are positive in Iowa. I think that's slightly below the national average of around 8 to 10%. Does that tell us anything important about the rate of infection, or could it be a product that we just haven't tested a large percentage of the population? And then I have a follow-up, if I might.
Yeah, so positivity rates are helpful, and you're right, it's dependent in part on your denominator, and part of when we look at those kinds of trends, and we do this for flu, for example, the flu positivity rate is in the 30s right now. Part of what it helps inform is activity, and we recognize even for flu, right, people sometimes get diagnosed with flu without an actual test, and so part of what's important to keep in mind, we do two things whenever we think about approaching an outbreak or approaching an illness, right? We're talking about tracking it and collecting information and numbers, which is really important, and we do that and we'll continue to do that. But we also do things like implement control measures, which are things like washing your hands, staying home when you're sick, and staying away from others. So we want to always keep doing those things in concert as we follow things like a positivity rate.
Does he have a follow-up?
Yes, my second question has to do with the hospitals. Do you think that we're prepared now better than we were a month ago? Have our efforts to slow the volume of cases given us time to accumulate supplies, work out staffing, and be ready for if a spike occurs?
Well, everything that we've done and every policy and procedure and that we've put in place has really been put in place in order to not, overwhelm and see that surge and place the healthcare system in jeopardy. And so as we continue to implement the policies and strategies and bend the curve and slow it down, as new tools that Dr. Padati, as she talked about, come on board, that really goes a long way in helping our hospitals be prepared and ready to go. But again, it's just like when I talk about the Department of Education and working with our school districts all across the state, the hospitals are meeting on a daily basis. They're coordinating, they're working through their health care coalitions to make sure that we're addressing it statewide. So those decisions and those discussions and those conversations are happening on a daily basis to make sure that we're not only meeting, the needs today, but the needs tomorrow, and then looking long term. As I said yesterday, we have to prepare for worst case scenarios, and they are having those conversations on a daily basis.
Next question, Radio Dubuque. Go ahead.
Yes, Governor, going to kind of go off the radar a little bit here. People are not stockpiling, I guess that's not the right word, but people have a lot of cans and bottles that they can't return. Redemption centers are not taking them. Stores where they purchase the cans and bottles, beverages, are not taking them back. Is there any way you can suspend that 5-cent deposit because people are not willing to throw away their money?
We'll add that to my legal counsel's, Sam's list of things to look at, and I don't mean to be funny. So, we did think about that earlier, that potentially could be a problem. So we'll review that and see if there's some things that we can do to help alleviate the issue that you just described.
Next question, KCRG.
Good afternoon, Governor. Thank you for having us on this. This is on shelter in place. I know the mayor of Cedar Rapids, some leaders in Lynn County have talked that they do want the shelter in place. But even just today, we had hospital leaders in Johnson County, where we've seen 43 cases, say they do not want a formal shelter in place because of supply chain issues, getting the products that they need, also causing more anxiety. Have you also heard from hospital leaders on this who are following along with you not putting a shelter in place on it? That's all.
Well, of course, that's part of the scenario when we work through, and that's some of the questions that they need to be asking. So what metrics are you going to use to stand back up? What have we missed in delivering the message that we have? Is there something that we're not utilizing? Is it consistent in the messages that we're delivering to Iowans? We need to talk about, we need to assess regionally, working with the healthcare systems. What's the available PPE and the workforce capacity by region? What is the supply chain? What is the enforcement? All of those different variables are taken into consideration when we walk through what it looks like to either implement a shelter in place and really who that needs to apply to. So as I said yesterday, we look at the data every day. We analyzed it based on the metrics that the Department of Public Health has put in place, working with what other states are doing, the CDC, and the other variables that they're taking into account. And then they make a recommendation to me and my team, and then we talk about what that looks like and how we move forward. So I think it's consistent, it's based on data, and as I said at the beginning, a lot of the things that we've already implemented are included in the shelter-in-place orders that states are putting in place. So I would say, what else are we doing by doing that, except for potentially disrupting the supply chain, putting additional pressure on, the essential workforce, and making sure that we are considering how we bring that back up, and actually, what's the benefit from taking that additional step?
Aaron
If you
Murphy,
need
next
to add
question.
anything. Okay.
Thanks, Governor. I'm wondering, when a test is confirmed, is there any procedure in place? Is there anything being done to identify and contact people who may have been in recent contact with the individual that was confirmed with the virus? In other words, is there any procedure in place to reach out to people who may have been close to the people who are infected as a means to try and slow the spread and just make other people aware?
I don't mind to, but
Yeah, that's a great question, and you're getting at case investigation or contact tracing, which is again a routine public health activity that we perform for all of the reportable illnesses that we follow at the department. And so we do that at varying levels, depending on the illness, depending on the public health measures that we're trying to implement, and sort of where our focus is. So, like many other things over the course of this outbreak response, there have been some adjustments made in the case investigation and contact tracing that we do. And in fact, right now we're working very closely and relying on our local public health partners to reach out to confirmed cases and ask them the questions that you're getting at about people who would have been in close contact. And in particular, what we're interested in right now are people in a home as well as people in a healthcare worker or, that kind of workforce setting. And again, it comes back to our big picture, which I think we've talked about a couple of times, is that we want to think about preserving our healthcare workforce and our healthcare resources for those Iowans who are sickest. And just to add a bit to a previous question, I think that asked about how prepared we are to, in addition to everything else, I think we heard Governor Reynolds say, I would again say every Iowan can help us continue to support our healthcare workforce by doing all of these things that we're describing here.
We're giving Channel 5 the next question.
Hey, Governor. I have a lot of parents writing in saying that their daycares are still charging them full price even though their children aren't attending because of COVID-19. Some are out of work, so this is really hurting their bottom lines, but also these daycares are small businesses that are also trying to stay afloat. Is there anything the state is doing to work on helping both the families and these private daycares?
Yeah, so I know Director Garcia looked at that when we were setting up the emergency daycare centers and working with existing daycare centers, whether we were paying on population or what they had previous to COVID-19. So I'll circle back with Director Garcia and see, where we're at in all of that and see if we can't get some information to you. I know we've looked at a couple different scenarios, and I don't want to misspeak and give out information that's not accurate. So through Pat, I will reconnect with Director Garcia and our team and see, kind of where we're at and help give some guidelines as we move through this. It's critically important. We know if we're going to be able to provide the healthcare workforce that we need, the supply chain for food, our first responders, we have to be able to have daycare available for them. So we will get that information and circle back with you when I have that.
Caroline Cummings, next question.
Hi, Governor.
Hi.
My question is about supplies. Gavin Newsom of California said last night he was coordinating with other governors to keep prices of PPE and other supplies down. I know you said recently that you haven't seen any price gouging, but I'm wondering if you are doing any coordinating with any neighboring states or states at all in order to get more supplies.
Well, I'm on a call with governors across the country at least probably 3 times a week, and I could probably be on more if I wanted to. So I am not aware of any, and I'm not aware of any price gouging from my neighbors north, east, west, and south. But, that can be a question that comes up. We just have not experienced it, but we have a great network in place. So, we'll continue to reach out to them and see if they're experiencing any. As to my knowledge, we have not yet, but it's something that we'll continue to monitor and watch out for because it's unconscionable during these unprecedented times. And so anything that we can do to help other states and other governors, of course, we're more than happy to do. So.
Last question, Daily Iowan.
Hey, Governor. I'm just curious. I've got a couple questions. Firstly, whether there are estimates on kind of a projected need for medical supplies in the coming weeks, if the virus continues to spread, and realistically, if we'll be able to have those supplies, so whether there'll be a shortage there. And then secondly, this is in a different kind of realm, but one of the main legislative goals at the beginning of this year was the Invest in Iowa Act, and I'm wondering if that's still on your radar at all or how that's been affected by the coronavirus as a whole.
Well, as proud as I am of the Invest in Iowa Act, I have to admit that's kind of on hold right now while we really meet the needs of Iowans. So we're focused every day to make sure that we can mitigate and slow the spread of the COVID virus, to make sure that we're really focusing on those most vulnerable that would be impacted the most severely by COVID, and to make sure that we're doing what we need to do to provide the resources to the outstanding healthcare providers that are working every day, our first responders, essential service members. So that's what we're focused on day in and day out right now. And as far as the supplies, you know, we've asked, they're asking the different healthcare providers to, you know, take a look at a 7-day supply. We take a look at numbers when it comes through Homeland Security, and they're placing their order both to their own vendors and through through the WebEOC. They are, when they bring those orders in, they're prioritizing based on the numbers and getting them where they need to go. So we just monitor it on a daily basis to make sure that we can meet the needs, and we're constantly looking for additional resources where there are shortages. But you know, Iowa's no different than any other state across this country. PPE continues, personal protective equipment continues to be a challenge, and we talk about it every day. We end at the beginning of the day and at the end of the day, and every hour in between, somebody on my team is trying to figure out what they can do to get the necessary PPE so we can protect those that are protecting Iowans on an every day. So we're working on that daily. And just to reiterate one more time what Dr. Padati said over and over, and what I've said, we all can help protect those most vulnerable, the ones that I just outlined, by really practicing the procedures that we've laid out since the first time we did one of these press conferences. So be responsible. We're Iowans. We can do this. Help us protect those most vulnerable, and let's figure out what we can do to get through this and get life back to normal sooner rather than later. And we can do that with your help. You can help protect those healthcare workers that are protecting those most vulnerable. So thank you.
Thanks, everyone.